I'm Dr. Ned Priest. I'm an interventional radiologist at Centennial Medical Center in Nashville, Tennessee. Until a few years ago, the only therapy for cancer of the liver, arising in the liver, or cancer that metastasized or migrated to the liver from somewhere else was either surgery or chemotherapy. Unfortunately, many patients were not eligible and remain ineligible for surgery because of other medical conditions such as heart disease, emphysema, and diabetes. Now, however, through technology, there's great hope for patients who have metastatic or migratory tumors to the liver and, to a lesser extent, the lungs. Those therapies come in three forms. First, the tumor could be ablated or destroyed by the introduction of a needle-like probe that heats up on the end and burns the tumor to death. The name of that procedure is radiofrequency ablation. That procedure is done under CT guidance with the patient asleep. The probe is introduced with the guidance of the CAT scan machine directly into the tumor to be killed. The probe is attached to a computerized heat generator, which heats the probe to a certain temperature and keeps it at that temperature throughout the treatment. Treatments generally last 10 to 15 minutes per tumor, and as many as 3 or 4 tumors in either the liver or the lungs can be killed in this method. We also have 2 other treatments that have been very beneficial in treating tumors of the liver or tumors that have metastasized or migrated to the liver. Both of these treatments involve injection of tiny beads like fine sand, into the artery to the liver. Once injected, these beads migrate primarily to the blood vessels supplying the tumor. Then they release their therapeutic material into the blood or into the tissue around the blood vessel to kill or stun the tumor. Some beads have chemotherapy in them. Once these beads are lodged in the small blood vessels leading directly to the tumor, they release their chemotherapy over a period of about 2 weeks. As a result, the tumor gets a very large dose of chemotherapy, but the patient's overall body gets a very low dose. This can be extremely beneficial in killing or stunting the growth of the tumor, and it treats all the tumors in the area of the liver where the particles are injected. The particles might also contain radiation, in which case they irradiate the tumor. We're able to choose which type of treatment we administer based on the number of treatments, the treatments that have been applied to the tumor before, and the condition of the patient. All of these treatments are generally very well tolerated. Radiofrequency ablation and chemotherapy bead treatments generally require a day, sometimes 2, in the hospital. Radiation bead treatments generally go home the same day. There's very little pain involved in any of these, and they generally extend life by about twice what could otherwise be expected. If your medical oncologist has decided that chemotherapy is no longer beneficial for you and that surgery cannot be performed to deal with the tumors of your lung or liver, I would encourage you to ask him if radiofrequency ablation or chemoembolization or radioembolization might be helpful. it never hurts to seek a second opinion. And your medical oncologist will not be threatened or offended if you ask to see someone about radiofrequency ablation, chemoembolization, or radioembolization. If you pick a person to see, I would encourage you to pick a doctor and a facility who can apply any or all of these treatments to your particular case so that you will have the full benefit of all the possible therapies for the disease that you or your loved one have. A diagnosis of cancer is frightening and bewildering. I encourage you to educate yourself and to ask your doctor and all the doctors you encounter along your treatment program to explain the reason for the treatment, how the treatment actually works, and what can be expected afterwards, and to explain this in terms that you can understand. Cancer is a minefield or a sea filled with icebergs. To navigate that, you need to be educated, and you will navigate that iceberg-filled sea better if you're educated and if you take ownership of your own path of therapy. You need lots of resources. And the Minnie Pearl Cancer Foundation at minniepearl.org has many resources that you can call on, independent of your doctor or your hospital, that can help you navigate this treacherous sea.